So, good day. My name is Gabrielle Alorro, and today I'm going to demonstrate on-chest physiotherapy procedure. So, let's begin. On-chest physiotherapy procedure. So, the first thing you will do is always wash hands or observe proper hygiene by washing hands. And also observe courtesy to the patient by introducing yourself and the procedure you are going to do to the patient. So, on-chest procedure. So, the first thing is verify the order. So, verification for order prevents potential errors. And the next thing is confirm the client's ID. Checking the identification ensures client safety through concept of correct procedure for correct client. And the next thing is provide privacy and explain the procedure to the client. By doing this, explanation protects the client's rights and encourages participation in care. And always wash hands or don gloves, face shield and a gown, and follow standard precautions. Hand washing and protective equipment reduce transfer for microorganisms and protect the nurse and the patient. So the next step you're going to do is auscultation. Auscultation determines baseline respiratory status. So good day sir, my name is JB and I will be your nurse. So can I assist you into a sitting position? Deep breath sir. So thank you sir. So the sixth step is positioning. So position the client as ordered. In generalized disease, drainage usually begins with the lower lobes, continues with the middle lobes, and ends with the upper lobes. In localized disease, drainage begins with the affected lobes and then proceeds to the other lobes to avoid spreading the disease to uninvolved areas. So the first segment is the upper lobe or the apical segments. So there are two segments. And the next is the anterior segment. Just assist the client into laying flat on the bed. So the next is the posterior segment. Assess the client or the patient into a prone position. So the next position or the segment is middle lobes. So the first is let the client position in an inclined position where his feet or legs is slightly elevated. And next is let him position sideways with legs crossed. So the next is the lower lobes or basal segments. So first, let him position in a supine position. Next is the basal or the right and left posterior facing or the prone position. The next is the lateral segments. By assisting the patient into a lateral position with his arms facing on his head. And on the other side, the lateral segment to the right. And the last segment is the superior segment with the client on the prone position with his arms upward. Instruct the client to remain in each position for 10 to 15 minutes and observe or perform percussion and vibration. So, percussion and vibration loosen secretions in target areas. To perform percussion, instruct the client to breathe slowly and deeply using the diaphragm. To promote relaxation, hold your hands in cup shape with fingers flexed and thumbs pressed tightly against your index fingers. To perform vibration, ask the client to inhale deeply and then exhale slowly through pursed lips. So good day, sir. Can I assist you into a sitting position? So we're going to perform vibration, sir. Can you inhale deeply and just exhale slowly into pursed lips? Okay, thank you, sir. You lay down now. After postural drainage, percussion, or vibration, instruct the client to cough to remove loosened secretions. First, tell the client to inhale deeply through the nose, and then exhale in 3/4 puffs. Then have the client inhale deeply again and cough through slightly open mouth. Sir, good day, sir. Can you lean backward into the headboard? So, when you inhale, sir, and just slowly exhale. I repeat it 3 times, sir. And then, can you cough, sir? 3 times. So, have the client perform coughing exercise for 1 minute and then rest for 2 minutes. Gradually progress to a 10-minute exercise period 4 times daily. And try to schedule the last session just before bedtime. So, scheduling chest physiotherapy before bed will help maximize oxygenation while sleeping. So, if the client's cough is ineffective, suction the client. Suction removes secretions that have accumulated in the trachea. So dispose of secretions appropriately and provide oral hygiene. So secretions may have a foul taste or a stale odor. So the next is auscultate the client's lungs. Auscultation evaluates effectiveness of therapy. And always record the date and time of chest PT, which chest segments were percussed and vibrated. So the color, amount, odor, and viscosity of any secretions produced in the presence of any blood. And complications and nursing actions taken, the client's tolerance of treatment. That's all. Thank you.